Well, good afternoon, and thank you for joining us for our weekly update. Today, I'm joined by Dr. Lawrence Lowe, our Medical Officer at Health at the Region of Peel, Tim Beckett, our Fire Chief and the Manager of our Emergency Operations Centre, Megan Nichols, Executive Director of the Mississauga Food Bank, and Mohammed Faqih, President and CEO of Paramount Fine Foods. Earlier this week, the Prime Minister and the Premier released some initial guidelines for the reopening of the economy. And while I know many were hoping for more clarity on the timelines, it's simply too soon. We're all eager to jumpstart the economy and get back to our workplaces, but the time must be right. And now, unfortunately, is not the time, not yet. We must remain laser-focused on protecting the progress we've made to ensure that our healthcare system can continue to manage this crisis while preventing a second wave. A resurgence would be disastrous to the health of our people and a further shock to our economy, making recovery even more difficult. And while the new federal projections and modelling indicate we have made progress on slowing the spread of the virus and bringing the epidemic under control, cases and deaths continue to rise, especially in our long-term care facilities. In Mississauga, we have 14 long-term care homes with 323 cases and, unfortunately, 37 deaths. Two of those homes, Camilla Care and Erin Mills Lodge, have serious outbreaks, with 20% or more of their residents fighting the virus. Citywide, we have 1,281 cases, and that is 28 new cases, or 2% increase over yesterday. In Mississauga, cases continue to increase, albeit single-digit increases each day. This is promising, but it's not enough. Yesterday marked the deadliest day since the pandemic broke in Ontario, with 59 deaths. Less than a week ago, Ontario experienced a record high of 634 new cases. The numbers speak for themselves. We are not in the clear yet. While we have made significant progress in our efforts, they're paying off. Our job is far from over. So please, I know the weather is getting nicer and people are bored in their homes, but we just need to hang in there a little bit longer. Now is not the time to bend the rules. And on the topic of bending the rules, we continue to see people disrespecting park amenity closures, non-essential businesses still operating, the littering of medical masks and gloves, and people gathering in groups of 5 or more. This despite my daily pleas to residents and businesses to please respect the rules. I'm starting to sound like a broken record, and frankly, it's frustrating. We have issued a total of 99 COVID-related tickets, and that was 19 last weekend alone. We now have educated over 18,500 people on the rules and turned away nearly 16,000 cars from our parks. A large chunk of these, 38 tickets, are related to littering of medical masks and gloves outside grocery stores, healthcare centres, parks, and in strip malls. I want to once again remind residents this is littering. It also is a health hazard and carries a fine. If you can't find a bin, just unroll the gloves and take off the mask, and please take them home with you. We've also seen a 200% increase in illegal dumping, mostly of household garbage in our parks. There is no excuse for this. We have increased garbage allowance by 2 bags because we recognize the fact that people are spending more time at home, hopefully all their time at home. While we usually experience a spike in dumping during spring cleaning, we have never seen anything of this magnitude, and it is concerning. Please, keep your garbage at your home. And while for the most part we've had great compliance, we continue to have to crack down on businesses who refuse to close their doors. Close your doors or we will close them for you. We also continue to see a blatant and reckless behavior in our parks. Make no mistake, we will continue to enforce these rules and do our part to keep you safe. As you know, Council and staff and our city staff continue to work to keep our city moving and have started planning for what recovery will look like here in Mississauga. Since my last update last week, we have, first, installed the first of several temporary bike lanes in Cooksville and in our downtown. With fewer cars on the roads and more people out cycling and walking, we want to take advantage of the 5,600 kilometers of road network to encourage active transportation in a way that's safe and keeps physical distancing top of mind. We've identified 9 areas for temporary bike and walking lanes, and we will be working with the local councillors and the community to move these forward. Areas with high density, those with lower access to parkland, and areas where the socioeconomic need is the highest will have a priority. We will continue to roll these out across the city and are looking at a pocket on Glen Erin between Erin Mills and Meadowvale next. Secondly, we're working to install customized plexiglass shields at the front of our MyWay buses that offer enhanced protection for our MyWay drivers. As you may remember, Mississauga, like many other cities, implemented rear-only boarding along with many other safety measures on our buses to protect both the passengers and the drivers. We made transit free at this time, as it is not possible for us to collect fares from the rear of our buses. This new interim solution was developed in-house and will not only enhance safety for our drivers, but will allow us to eventually resume the collection of fares. Free transit, while excellent in principle, is costing us $7 million per month, and this is revenue that is greatly needed to address our $43 million revenue shortfall as a result of the pandemic. Third, we're moving forward with construction season on essential projects only, in compliance with provincial regulations. Thanks to residents who are doing their part to help stop the spread of COVID-19 by staying home, we have fewer vehicles on our roads, making this an ideal time to give our roads the attention that they need. In addition to road maintenance, we will make progress on nearly 30 projects across the city, including sidewalk and trail construction, bridge repairs, and the construction of new stormwater management facilities, among other projects. Keeping our city moving and in top shape is key to our competitiveness and will be critical once we restart the economy. Fourth, we are launching a new interactive digital map of 70 free outdoor Wi-Fi locations across our city that can be used while maintaining safe physical distancing. We are encouraging those who need access to the internet to rely on our city's free public Wi-Fi network. We also continue to leverage our library hotspot lending program in certain situations to help those who cannot afford a data plan, including seniors who are restricted in their homes. We also continue to connect with residents in need of commercial subsidized internet programs offered by cell providers and other programs to cap data user fees. Long-term care homes operated by the Region of Peel also offer free Wi-Fi, and we're working on implementing the same in our shelters, including those for our youth. And finally, fifth, we continue to make progress in our plans for recovery and for reopening. Members of our leadership team are meeting to discuss what Mississauga's plan will look like. What I can tell you is that we have the right people at the table, including our Economic Development Office, our Medical Officer of Health, and many divisions across the city, from parks to recreation to transit and others. And now, I'd like to invite Fire Chief Tim Beckett, who is also responsible for leading Mississauga's Emergency Operations Centre, to provide us with an update on our reopening and recovery efforts. Thank you. Over to you, Chief Beckett.
Thank you, Madam Mayor, and good afternoon, everybody. We've been operating the Emergency Operations Centre now for 50 days. Staff have been monitoring activities 7 days a week, and we're working very closely with the Medical Officer of Health and the Regional Emergency Operations Centre. We are ensuring that we are able to provide all the direction and guidance to our citizens here in Mississauga. We're also ensuring that we have the necessary essential services that are required by our citizens since the start of the pandemic. These have included enforcement, building inspections, fire inspections and fire response services, enforcement services, 311 call center, and any critical works in transportation and works department. Our parks and forestry staff continue to ensure that trails and parks are kept safe and clean. A number of critical services internally are operational to support the frontline essential services. As a result of strong business continuity planning throughout the city, although City Hall is physically closed to the public, many of our public services remain virtually open, and we have most staff able to work in various capacities from home and maintain a level of service. Our enforcement teams continue to deal with those that ignore provincial orders. We have focused on educating, and most people have been cooperative. We continue, though, to see littering of gloves and masks in store parking lots. Please dispose of them responsibly, either in garbage cans or, as the Mayor said, simply roll them up and take them home and dispose of them at your home. Our Office of Emergency Management team is working in conjunction with the City Manager's Office and our corporate leadership team to continue to review recovery and reopening frameworks. Staff are working on several possible scenarios that reopening the city facilities and parks amenities would look like. We know reopening will be gradual and will be phased in, and will take into account physical distancing and enhanced hygiene. We will operate in a new norm. We will be ready for whatever direction public health gives us, and we will work collaboratively with them to do the right thing. As these become clear in the future, we will be in a better position to communicate our framework to the public. As the fire chief, with everybody spending more time at home, I will again remind people to remain vigilant around fire safety. Fire does not pause for this pandemic, and we need you to ensure that your homes and you are fire safe. Do not leave cooking unattended. Ensure that candles are used safely, and discard smoking materials. And with the weather starting to turn nice, we would remind people to remember that open-air burning has a number of requirements and cannot create that nuisance to your neighbors and the neighborhood you live in. Please avoid burning if possible, and if you must burn, please adhere to the rules as set out. I want to remind everybody to remain safe out there and be safe out there in all aspects of this pandemic. Thank you.
Thank you to the Chief. And now I'll turn it over to our Chief Medical Officer of Health at the Region of Peel, Dr. Lawrence Lowe, to provide us with a brief update on the Peel Region's response to the virus. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. As of noon today, Mississauga has seen 1,281 cumulative cases of COVID-19. Of these, 100 have required hospitalization, 133 have recovered, and 73 have sadly passed away. Of those cases and deaths, as the Mayor has already shared, 322 of those cases and 37 deaths have occurred in long-term care settings. And that's what I want to speak about this afternoon. Mississauga, like most communities in Canada, is seeing the pandemic unfold in two settings. In the community, Mississauga is starting to see a leveling of transmission, and this is in no small part thanks to the collective efforts of the many people and businesses of Mississauga who have taken our advice to stay home and physically distance. I remain concerned, however, that we continue to see severity in our healthcare system, deaths, and also increasing outbreaks in our senior settings in Mississauga. Yesterday, Public Health Ontario released a report analyzing 1,500 COVID-19 cases in the province and has identified similar patterns of morbidity and mortality to other jurisdictions in the world. Those findings show that our 65 and over crowd is very much at risk. And so while Peel Public Health certainly keeps those impacted by COVID-19 in our thoughts, I can also share that we are working tirelessly with our healthcare, hospital, and long-term care partners to interrupt transmission in our senior settings while preparing other homes to keep COVID-19 out. To date, Peel Public Health has worked with partners to complete testing and broad infection assessments and outbreak control at 20 homes considered high risk across the region. We have also we are also finishing with 8 homes with emerging challenges that will be finished by this weekend. We also retain capacity to respond to urgent needs that arise in other congregate settings, including retirement homes and group homes, while also liaising with our partners on staffing, PPE, and other care efforts in these settings. Despite our broadened response, however, the overall picture means that we must stay strong on our current measures for the moment. I have been inspired by how Mississaugans of all backgrounds have taken our recommendations to heart, reducing interactions and moving life virtually. I ask that you continue to do so, even as the weather turns nice, even if FaceTime is better than Facebook time. It is time for us to get through the next phase of this pandemic and keep the course going for our seniors, for the vulnerable, and for those who sacrifice each and every single day, our providers, responders, healthcare workers, and essential workers. We cannot let our efforts be in vain. We must bring the picture in our healthcare and long-term care settings under control and keep the transmission in our community slow as we focus our attention there. We will get there. Until then, though, I will say please stay well, stay apart, and stay home. I will also applaud the Mayor and the City of Mississauga as an avid runner. It's exciting to hear that active transport lanes are being developed in different sections of the city, but I urge you all to remember, use them for exercise, by yourself, with a pet, or with someone else. Do not use them to congregate. Thank you very much, and I'll pass it back to the Mayor.
Thank you, Dr. Lowe. Well, with May 1st quickly approaching, many of our residents and landlords across Mississauga this month their rent will be a particular struggle. And while both the provincial and the federal levels of government have provided extraordinary relief to our residents, there's still one more area that I think needs immediate attention, and that is residential rent. While the province has forbidden evictions during this emergency, I fear that once this is lifted, many will find themselves without a home. The average rent for a one-bedroom apartment in Mississauga is now over $1,900 a month. This does not include larger units for families. Even with employment insurance or the CERB, the CERB, there is not much left remaining for food, for utilities, and other monthly living expenses. $2,000 does not go very far in Mississauga, as it does in the smaller communities outside the GTHA. In Mississauga, we've done what we can by deferring property tax payments for 3 months, waiving late penalties on our utility bills, and deferring rents for tenants in our city facilities. We would like you to do more and offer rent relief to residents, but as you know, municipalities do not have the financial tools to do this. Without a safe and secure place to call home, many will struggle to maintain or seek employment and will become increasingly vulnerable. My ask is for the province and the federal government to work together to provide interim rent relief as soon as possible. I've written a letter to both Ministers Philip and Morneau outlining the need and the immediacy around this request. This is one way we can help protect the well-being of our people while creating the conditions for our local economy to rebound. Many of those who are struggling to make rent have lost their jobs and are also struggling to put food on the table for their families. And this breaks my heart. No one in our city should worry about where their next meal is coming from. Emergencies like these put additional stress on already tight budgets. More and more families are relying on food banks to feed their families. And now I'd like to welcome to the podium Mohamed Faki, CEO of Paramount Fine Foods. Mr. Faki.
Good afternoon, everyone. I hope you, your teams, and families are staying safe. I come here today feeling very thankful. Let me begin by thanking the Mayor and City Council for allowing the evening call to prayer to be broadcasted during Ramadan. You have shown an amazing understanding of the importance of faith in these most difficult times for all of us. I'm also thankful to tell you all what we've been able to achieve so far for the food bank right here in Mississauga. On April 8th, we launched the Mississauga Food Bank Challenge, along with Mayor Bonnie Crombie, to raise $840,000 to support the Mississauga Food Bank. And I'm pleased to announce that we have reached our goal. we have raised $840,000 in less than 20 days. I also found out that the food bank needs another $325,000 to support the children, senior citizens, and families to have the healthy food that they need and deserve. And I'm delighted to announce since last Thursday, we start fundraising towards that goal too. All what we need from all of you is one more week of your help, spreading the word and donating if you are able to help us reach this new target. I always say this city and this country isn't just a country. This is one big family. And families stand as one through even the hardest times. We say, what do you need? And not what can you give me? So let's stand together and support the most vulnerable in our community to reach and to help us meet that second new target. Donations can be made to the MississaugaFoodBank.org. Thank you so much for your generosity, for your support, and for being the best people in our country. Thank you once again. And please donate if you are able and stay safe. Thank you.
Good afternoon. I'm Megan Nichols, Executive Director at the Mississauga Food Bank. First off, I'd like to express a huge thank you to all of the individuals and organizations who have stepped up to the plate and joined the Mississauga Challenge. I can't believe that we've already hit our initial campaign goal and raised over $840,000. This money is already at work providing food to feed hungry kids, families, and seniors here in Mississauga. And all of this would not have been possible without the support of our dedicated community leaders and, of course, all of you in Mississauga. The reality is that we need your help to feed neighbors in the months to come. The continued support will help families across our city. Families won't have to choose between paying rent and putting food on the table. Kids who don't have their food and snack programs at school will receive food to eat at home. And anyone in our community who is struggling to make ends meet during this difficult time can find the support that they need. It is only by joining together that we can raise the remaining funds required to get us through this critical period. We're already 76% of the way towards our new campaign goal of $1.1 million, and I know that together we can do this. So today, will you accept the Mississauga Challenge and join us? You can visit our website or give us a call. And remember, for every dollar that's donated, food for 2 healthy meals will go out to a neighbor in our community. I'll pass things back to Mayor Bonnie Crombie.
Well, thank you, Mr. Faki, and thank you, Megan Nichols. And yes, we all accept your challenge, and we will all step up. Thank you. We are truly touched by your efforts and urge those who have the means to continue to show your support for the Mississauga Food Bank. I want to close by once again asking residents to continue the good work. We're all antsy. We're eager for life to return to normal, whatever that new normal looks like. And I've said this many times before. This will be a marathon. It will not be a sprint. We need to go slow. We need to be smart. And we need to do things right the first time. Our response must be safe and it must be measured. We cannot afford a second wave of this virus. Let's continue to take the Team Mississauga approach to fighting this virus. And finally, I'd like to invite our residents to join us for a 3rd citywide teletown hall on Tuesday, May 5th at 6 p.m. Again, that's Tuesday, May 5th at 6 p.m. You will receive a call to your homes. Details can be found at mississauga.ca. I hope you can join us. We look forward to answering all of your questions. Thank you, and now I look forward to taking questions from the media as well.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Hey, Mayor Crombie.
Hello, Ashley.
So you've talked more about Mississauga's own reopening plan, and earlier today during a council meeting, I believe Councillor Pat Sato brought up that a lot of Mississauga's reopening plan has been done kind of behind the scenes, and that the city's been talking to senior city staff members and BIAs and businesses. I was wondering if, in the coming days, if you think it would be a good idea for the city to actually start making its reopening plan more public, if only to kind of give residents, I know you don't have the power to set dates or decide which places will open when. The province needs to do that, but do you think within the coming days you'll kind of be able to give residents and businesses a kind of public blueprint of how the city plans to reopen when it's safe to do so?
Ashley, it's a great question, and I want to thank you for it. And we are still in the consultation mode, and we're working with senior staff. And let me also share that we are consulting, and we want to have a unified response. So first of all, we take our lead from our Premier, who will set out that blueprint map for us, and then the Ontario Public Health Officer and our own Peel Public Officer of Health, and then our lead from our own Chief Tim Beckett, who is leading our response team and the recovery and reopening. I will also share with you that the GTA mayors have met and have discussed that our response be uniform, so that when we can all reopen the facilities in our parks at the same time. So all the park facilities and other small businesses that will open in a very staged and measured way, we can open at the same time. I don't know if Chief Beckett, do you want to maybe add anything there? So we continue to consult, we can continue to work behind the scenes, we will have a blueprint ready, and of course, as I mentioned earlier today, we're continuing to consulting with all the small business groups, the Economic Development Advisory Committee, and the BIAs, et cetera. Chief Beckett, do you want to add anything?
Thank you, Madam Mayor. Ashley, as we work through this, there's a number of pieces that we're going to look at. Some of it will look at the reopening of City Hall. Some of it will be the city finance, and some of it will be the economy and in Mississauga. So there's a number of moving pieces that we're going to continue to work through. We have a team on it right now, and as soon as we can finalize up what all those pieces look like, we'll definitely be able to share it more formally with the public. We are, of course, working closely with the other levels of government and our Peel Public Health to take direction on what that looks like as well.
Thank you.
Thank you, Ashley.
And as a quick follow-up, this is about Celebration Square in particular. I know that the city is canceling or not allowing any big public or private events until the beginning of July. I know that in some other cities, some individual organizations and some cities have decided that they're not going to allow any events through the summer at all, out of an abundance of caution. Celebration Square obviously has a ton of events in the summer, not just big ones. You have your movie nights, you have your outdoor fitness, and little events like that people look forward to. Has the city been talking about potentially canceling these events through the summer, or even just finding a way to perhaps limit capacity if you need to?
So this is all part of the reopening plan, Ashley. I will share with you that many of the wonderful festivals we host in Celebration Square have been canceled this year because it was just too much uncertainty involved, and we still don't know at this time what we'll be able to host and what we won't be able to, whether small groups will be able to gather or larger groups will be. We don't know at this point. There are still too many unknowns, so it was too high risky a venture for them to put down deposits for some of the festival activity that they need to secure talent and suppliers, et cetera. So they have decided this year in an abundance of caution to cancel their festivals. Whether we would move forward with something like a movie night where fewer people, spaced adequately at 2 meters apart, that's something we will discuss in the days and weeks to come. I would say as of right now, probably not, but maybe things will improve towards the later part of the summer, that things may change.
Mayor Crombie, your next question comes from Joe Warmington from the Toronto Sun. Joe, please go ahead.
Thank you very much. And to the mayor and to the others, congratulations on reaching the first goal on the food bank. That's good news. And I have two questions, if you don't mind.
Certainly.
The first one, they're both tough questions. The first one is on the numbers, and I may have missed it at the beginning. Have you got, Mayor Crombie, in front of you, what Mississauga's COVID numbers are in terms of
Yes.
people that have it, and
Correct.
also the death numbers?
Yes, I do. We have 1,281 cases today. That's an increase of 28 cases. We have 73 deaths. That's an increase of 7. We have 133 people that have recovered. We have 323 cases of COVID positive in our long-term care facilities and 37 deaths. And that represents a 2% increase from yesterday, and the day before was a 1.6% increase.
At first blush, the numbers are, probably among the best in terms of percentage in the country, I think. Am I right? I mean, it seems like it. The population.
I'm not sure I could take that much credit. There are some small. Sorry.
What is the population of Mississauga?
Just under 100,000. We like to say about 780,000.
Just under 800,000, right?
Correct.
So, so the one number that stands out is that 37 are in long-term facilities, which means more of the deaths, or at least maybe not more of the deaths, but many of the deaths are non-long-term care facilities. Do you know what the breakdown of what that would be?
Sure, we do, and I'm going to ask Dr. Lowe to come up, but we've had 73 deaths. 37 of those were in the long-term care homes. We know that 78% of the deaths have been in people with 70 years of age and older. But why don't I ask Dr. Lowe to come up and share those numbers with you?
Thank you.
Thanks. I actually don't have all the exact numbers at hand right now, but I can say that these are updated daily on the Region of Peel's coronavirus dashboard. So if you go to peelregion.ca/coronavirus/case-status, or if you just go to peelregion.ca/coronavirus and you click on the status of cases in Peel Region, it'll bring up a dashboard, and there's a number of drop-down boxes that will give you what you seek in terms of identifying cases and deaths by municipality, by age groups and age range, and also in long-term care and retirement home facilities. I'm happy to answer any questions you might have around sort of broader trends. Certainly, as I mentioned. Yeah, go ahead.
Well, Dr. Lowe, thank you. I think the number that jumps out, obviously it's great, terrible that anybody died, but compared to other places, the numbers are better. But the one number that really stands out is that half of the deaths are outside of long-term care. And is that, I mean, I'm not making any assumptions. I'm wondering what that means. Is that a statistic because people were in the ICU or some other factor, or does it mean that the other 30, 32 or 3, whatever the number is, contracted it out about?
So the deaths refer to where the individual had passed away. So usually, well, at least in terms of the long-term care homes, we know that those are specifically residents of long-term care homes. The rest of the deaths, in general, the trends that we've observed are these tend to be hospital-related deaths, certainly people who are in critical care and ICU, though we certainly have had deaths in the community as well. But I mean, that information is certainly something that we're tracking as well, but the focus has very much been on long-term care.
Do you think that means, Doc, that the 79% that Prime Minister Trudeau was talking about yesterday is probably likely a combination of people that were long-term care and also ICU or long hospital stays? Because it doesn't make sense that, that it would be higher in Mississauga. So it must be more of how they've added it together.
I would imagine you'd have to ask our federal counterparts for that, but I do know, at least anecdotally, certainly in Quebec, for example, the vast majority of deaths there that have been in, I believe, in long-term care settings. So if you're looking at a national picture, you're probably weighing the picture that you're seeing in some parts of Canada where there may be more deaths in long-term care, and then certainly the picture that we see here in our jurisdiction. I would stress, however, that we are certainly very focused, laser-focused on the outbreaks in our long-term care and retirement home settings. Those are very much really where the pandemic is starting to unfold here in the region of Peel.
If it's okay, I don't want to, I know people are waiting, but I have one more question for Dr. Lowe, and then I'd like to ask one more of the mayor, if that's okay.
Sure.
Okay, where do you stand, Dr. Lowe, on the vaccine issue. There's a lot of debate over it. People are saying that, you know, we may have to wait until one is developed. I don't know. Do you know a lot about that, and where do you stand on it?
So having worked in vaccine safety at the federal level, I know that it can take approximately 12 to 18 months in order for a vaccine to typically get to market. Certainly, I know that many governments around the world have put a rush on this, and so it'll remain to be seen what comes up. And that's in a best case scenario where we can develop a vaccine. I think really, you know, you've been hearing from our federal counterparts and our provincial counterparts the importance of ensuring that we have good testing capacity, continuing the case and contact tracing work that we do here at Peel Public Health and certainly at all public health agencies across the country, and really focusing to make sure that we have the ability to identify, detect, and isolate cases in a rapid manner so that we can then interrupt chains of transmission in congregate settings and senior settings and in our healthcare facilities, but also in the community to really bring this under control. And I think in the short run, that's probably the best place we're going to get rather than sitting here certainly waiting for the vaccine cycle to play out. I'll pass it back to Madam Mayor.
With that in mind, okay, great. Thank you, Doctor.
And Joe, your final question for the mayor?
Joe, before you,
the final question.
Joe, before you start, I have some more numbers for you that I took notes from our last briefing with the CEOs of the hospitals and Peel Public Health. So the average age of patient is 73. The median age of death is 84. 78% of deaths are age over 75. And 65% of the deaths are males, except over 80, where there are female.
Okay.
Largely because women live longer.
Okay, so based on those numbers, and the fact that a majority of this is, you know, in the homes, in the hospitals, I wonder about, you know, with Mississauga's, you know, probably the world-class, particularly lakefront parks, but there are other parks, but particularly the lakefront parks. Is there any idea to come up with an out of the box approach, you know, whether it's by cell phone appointment or lottery or something, to as we go into the warmer weather come next month and the month after, to find some way to get some people to be able to social distance in those places for morale reasons, all kinds of reasons. Mm-hmm. Or is it going to be just a matter of it's shut until this is over? No other city, by the way, that I've heard, in Ontario at least, has taken this approach. It seems that it's mostly just, you know, shut it down until it's over. And I wonder if there's any consideration to something like what I described in that it would involve social distancing and, you know, masks and gloves and things like that as well.
So with respect to the parks and trails, Joe, the parks are open. It's the amenities within the parks that are closed, and those are the basketball courts, the soccer fields, the tennis courts, the leash-free dog parks, the playgrounds, etc. And the reason they are closed is because we can't ensure that they're sanitized properly, and also they are places where people come together to gather. So we had to shut them down because they were places where people congregated. And people still are walking the parks. We ask that they wait till off-peak hours, or if there are too many people at one time, to turn around, go home, or try a different route that day. But we're certainly encouraging people to go out for a walk in the nice weather, just to practice safe physical distancing and not to do it when there are very many people around at the same time. On the question of whether masks and gloves will be part of the uniform going forward, I think we'll take our advice from Dr. Lowe, who has been telling us that to date, proper, safe physical distancing has been the primary way to protect ourselves and keep ourselves safe. I also want to comment with respect to other municipalities and what they're facing. I do understand that in the urban areas, the more heavily populated, denser communities like the GTHA, certainly this is a place where we have been more greatly impacted by the virus, and we have seen a prolonged spread of the virus than and some of the smaller communities that are less dense. And there are communities across Ontario that aren't experiencing the kinds of increases we are, and there's, I will venture to say, some that are COVID-free, don't have new cases like you see in Saskatchewan. However, in the GTA, that is not the case.
Mayor Crombie, your next question comes from Samia Madwar from the Walrus. Samia, please go ahead.
Hi, Mayor Crombie. My question to you is about the Mississauga Challenge and
yes.
the raising. So my question is, so you see that Paramount is involved and leading the way, and I'm just wondering if there are any other restaurants or players in the food industry who are also involved, or if there's any thought to, working with restaurants and other businesses that have had to be shuttered, and if they're at all involved in this effort to provide food to food banks.
So there are many restaurants that are stepping up and feeding our frontline healthcare workers and providing food to shelters, much the way Paramount Fine Foods is. They've been they just happen to be the first that did so. Avani Indian Fine Foods have done so. World Meats has done so. Oasis Banquet Hall. There are groups of citizens who come together to organize prepared meals and drop them off either at shelters or for seniors or for frontline care workers. Mohammed Faki and I participated with a group called Rescue last Friday, and we provided food from Paramount Fine Foods and from Earl's to the frontline health care workers, the doctors, the nurses, etc., Friday evening, and then we walked over to Camilla Place, to the long-term care home, and provided them with meals as well. So you do see many groups stepping up, whether they're restaurants or they're groups of citizens who have come together. I couldn't even list them all, but there are many, certainly many corporations and companies who are retooling and providing shields and donations of shields or masks, including Anubis, including Premium Candle, to name a couple. And then there are others who are making monetary donations, whether they're to the food bank or to Trillium Health Partners for PPE, or to both. And I will say Electra, our utility provider, as well as American Eagle, have provided monetary donations to both organizations.
Thank you. And if I may, I'd just like to ask a follow-up, and that is how long the current funding target, how long that is expected to be effective for, how long will that carry the food bank during this time?
Are we talking about the Mississauga Challenge? How long will we carry the campaign? Yes. So the first tranche of the campaign lasted, Megan, about 2.5 weeks, I think. And we were very blessed that people like Mohammed Faki stepped up, superfan Nav Badia, a local realtor, Sam McDaddy, all issued their own challenges to their own communities. We're very fortunate that RJ Barrett, who is Mississauga boy, who plays for the Knicks, stepped up and donated $100,000. We owe the Firefighters Benevolent Fund donated $150,000. We're very, very grateful. It's hard to know whether we can sustain these very large donations or if they came in this first phase of the campaign. But we have to raise more money because the virus, the pandemic continues, and it's impacting families, it's impacting lives. People have lost their jobs, whether temporarily or in the long term, have been laid off. So we need to continue to raise money to continue to feed local families. So that is why we have now issued another $1.1 million challenge to continue to raise the money that the food bank requires. And if you want a list of those who have contributed, we're happy to provide those for you. I'm just doing so off the top of my head of some of the larger donors.
Thank you very much. I don't know if it's possible for me to just clarify. Yes, I would love that list. I just wonder how long this target, how long would that funding be effective for? How
yes, we certainly have those. We have that information for you. Every dollar provides 2 meals. And Megan, why don't you come up and respond to how long we may need to sustain this campaign? And Megan will give you her contact information, and she will provide you with the list of public donations that she's had come in.
At this point, the funding will see us through the coming months. Our initial estimations were looking at needing to provide food through to the beginning of the summer, and now this additional funding we're hoping will help us purchase food that we'll need through the end of the summer. And so we're playing it by ear and following the direction that we receive from public health as well. And it all depends on how serious the impact is on the economy for how long this finance will last us. We've seen a 10% increase in client usage so far of the food banks, and some regions across Canada are seeing over a 20% increase. So we will, our plan is that this will see us through the coming months, but we may need to come back to the community again for additional support depending on what the need looks like in our community.
Thank you, Megan. Mayor Crombie, your next question comes from Steve Cornwall from the Mississauga News. Steve, please go ahead.
Hi, Steve.
Steve, are you there? Steve, are you there?
Hey, can you hear me?
Ah, there he is. Now we can. Thank you, Steve.
Sorry about that. Just a question about the rent piece. You mentioned earlier on that the city had passed, or had deferred property taxes for residents. One question to start, do you think that landlords have passed those savings on to tenants? And just a quick follow-up on that, what kind of aid are you envisioning for on the part of federal and provincial governments in the city, expensive to kind of rent out Mississauga?
So we have deferred rents for 3 months, and we were very hopeful that landlords would pass on those savings, those deferrals to their tenants, and many have made personal and private accommodations with their landlords for, different arrangements, whether they're long-term deferrals or whatever they may be. There are many arrangements have been made. So I can't speak for all landlords, but I know that many have done the right thing and have passed on the deferrals to their tenants. Steve?
Just the piece around. Hi, can you hear me?
No, I'm sorry, you're breaking up a bit. All I heard was just the piece.
I was asking the piece around the federal.
The federal, provincial, we've asked them to provide. We've asked them to provide interim rent relief in the same way they have provided business continuity funding and subsidy to individuals through the enhanced employment insurance and the CERB, the Canada Emergency Response Benefit. There may be a way to also provide rent relief, much needed rent relief to many people who have lost their jobs in this economy as a result of the pandemic. And we have issued letters to the federal and the provincial ministers of finance requesting that. And just outlining the need and the immediacy of the request. Sorry, Steve, you're breaking up a little bit. I apologize.
On the plexi again?
Did you say, are you speaking of My Way, the plexiglass barricades? I apologize, Steve.
Yes, is that going to roll out the physical distancing? Is that going to roll out
Hi, Steve. Nicole here. If you just want to message me your question, I'll read it out to the mayor for you. In the meantime, we're going to move on. In terms of your next question, Madam Mayor,
sure,
is from Isaac Callan from The Pointer. Isaac, please go ahead.
Hi, Mayor Crombie.
Hey, Isaac.
I want to follow up on the financial projections from staff a few weeks ago, because I remember, I think it was losses of around 36 million for April.
43.
And I was looking at 43 to understand how those projections are playing out. Are they ahead of where you thought? Are you losing a little bit less, a little bit more? Do you know what the situation around is?
So it was 43 million to the end of April, and it'll be 60 million to the end of June, and 100 million, 90 to 100 million should this continue for till the end of the year. We will realize some savings. We've realized savings of about 2.3 million in the layoff of the 2,000 people that were part-time staff that were staffing all our facilities that are now closed. And that savings should grow to about 8 million by the end of June. So there will be some savings, but at the same time, we also have no source of revenues. We're losing $7.5 million a month through not collecting fares in My Way Transit. We have no other income that we used to collect, user fees at our recreation facilities, parking fees, etc. So we are collecting no fees and no transit, and we've deferred all property taxes.
Thank you. And my follow-up's for Dr. Lowe, if that's okay.
Absolutely.
Hi, Isaac. How's it going?
Hi. Something that I think a lot of journalists have been hearing about is from concerned relatives of people in long-term care and retirement homes. And something I've heard from one individual is they've really struggled with information from a retirement home about the level of an outbreak and how many cases there are, and concerns of delay in information. I was wondering if you could explain the timeline for how retirement homes report their cases to the region and how those are then shared with the families and public.
Yeah, I'm happy to share. So in general, throughout the course of testing, what happens is tests are sent to the Public Health Ontario laboratory. Results are disclosed subsequently both to the ordering physician and or the retirement home or a long-term care home, and then also to the Region of Peel Public Health. You can certainly appreciate that we, at least at the public health side, get all of the tests in aggregate. So, hundreds and hundreds of tests. We've tested over 4,000 long-term care home residents and staff in the past week and a half, and the focus of our information is really putting together a picture of the outbreaks in these homes. You can find a picture of outbreaks for individual homes on our data dashboard now, the same one that I mentioned earlier, peelregion.ca/coronavirus/case status. And if you go there, you'll see a little button that allows you to identify staff and residents. Now, certainly the data is updated on a somewhat regular basis, but certainly we do recognize that many long-term care homes are certainly working their best to keep the families and their loved ones informed about the outcomes of tests. We in public health will certainly reach out with positive tests, at least from the perspective of isolation, et cetera. But I certainly hear the concerns, and like I said, from our perspective, certainly we're working with our long-term care partners to ensure that families are kept informed. But our information is all available at peelregion.ca/coronavirus.
And extremely quickly, is that data a day old, 2 days old, 3 days old when people are seeing it in terms of what it represents? It's
a day old based on what was pulled from our database. However, there is a variability depending on whether it's cases or whether it's deaths, for example, and the time lag between which we receive that information. So, for example, when it comes to death reporting, it will depend whether there was a positive case before a pre-mortem or post-mortem, and all these other pieces. Certainly there's some variability on the back end, but what you see on the database reflects what you see on the dashboard reflects what was entered into our database in the previous 24 hours.
Thank you, Dr. Lowe. Mayor Crombie, I'm going to read your last question on behalf of Steve. He's wondering if the plexiglass and eventually charging fares again will roll out before or after physical distancing measures are eased.
No, those in fact are being rolled out right now, Steve. That we're installing the plexiglass beginning this week. It'll take a couple of months before all of our buses have the plexiglass shields installed, but that work is currently underway.
Madam Mayor, that's all the questions for today. This concludes today's press conference. On behalf of Mayor Crombie, I want to thank everybody for participating. Our media team will be sharing a link to the video of today's press conference with you shortly. Have a great day and stay well.
Thank you.